Adult-onset ADHD. What does that look like? I'm Dr. Trish Leigh. I'm going to answer that for you. The answer may astonish some of you, especially if you think that you are struggling with adult-onset ADHD. Friend, I'm sorry to tell you, that doesn't exist. It is likely something else. ADHD, in its true sense, is a neurodevelopmental disorder. So neurodevelopmental means neuro, having to do with the brain, developmental, something you are born with and that occurs within and across development. So you can't develop a developmental disorder in adulthood. But what you can develop in adulthood, which is likely what you're struggling with, is burnout. I'm sorry to tell you that burnout manifests in many of the same symptoms. And in my private practice with my illustrious husband, we see so many adults at Leigh Brain and Spine that come in and they say, I am suffering from adult onset ADHD. But then when we dig a little further, we find out that indeed that person has been anxious and has anxiety and stress that has been building and accumulating over years. When your brain uses all of that fast, high energy, high beta, in an anxious state, and especially if you have chronic stress or anxiety, what happens is the brain exhausts itself. Your system will go into adrenal fatigue. When your brain becomes exhausted, it starts using too much slow and extra slow speed, theta and delta. So when theta, slow speed, goes up, you will then have symptoms that mirror or look like ADHD. So you'll have difficulty thinking and focusing, your productivity may go down, you may be distracted, you may find it difficult to use executive function skills, planning, organization, taking a big picture project, chunking it down and being able to put those steps in place. Your memory may slide, you may not remember doing things. That's because your brain is using too much extra fast speed and too much slow speed simultaneously. It's very much like the ADHD brain pattern in the way that the energy is being used in your brain, but it's happening for a different reason. If you're born with ADHD, there's nothing you can do to undo that ADHD pattern, except for neurofeedback, of course, which is scientifically proven to change that ADHD pattern. If you are struggling with burnout and you feel like it's adult onset ADHD, guess what you have to do? You have to back yourself out of that stressed out, overdrive, too busy mode that you're likely in and give your brain the rest that it desperately needs. And if you're not able to do that, neurofeedback is exactly what you need, because neurofeedback will teach your brain to make less of the extra fast speed, less of the slow speed, and more of perfect processing speed in the middle without you having to try so hard on the outside. And we work with so many people that are just so stuck in this mode, they can't even try. They're so jammed up, they need something to unjam the energy in their brain, and that something is neurofeedback. Okay, so I hope this helps you understand that you definitely don't have adult ADHD, but you probably are suffering from chronic anxiety, stress, overdrive, go, go, go mode that has exhausted your brain, and you've started to use too much slow speed and you feel like you have ADHD. Okay, I hope that helps you out. And remember, control your brain or it'll control you.